So in Ontario, we've received, or we've actually achieved a lot of significant results with our enhancing young and novice driver safety. And yet collision rates for a group 16 to 19 years old continues to be a real problem for us because it's disproportionate. And I'm sure that's the same for every jurisdiction out there. In 2010, 24 of 299 drivers killed were between the ages of 16 to 19. That's 8%. That's troublesome when you think that they represent only 5% of our licensed population. So today's presentation will answer 3 questions. We wanted to know whether the beginner driver education program had an impact on road safety for young drivers. We wanted to know what is the effect of time discount. We offer a discount if you take a program when you move into the second part of the GLS program, whether it was positive, neutral, or negative. And we also wanted to know whether the Auditor General in Ontario in his report in 2007, when he said that BDE had a negative impact on road safety of novice drivers, whether that was true. So at the end of this presentation, I'll answer all of those 3 questions. So, in 1994, Ontario became the first jurisdiction in North America to introduce a comprehensive GLS program. BDE is one component of that program. So before evaluating the one component BDE, we wanted to look at GLS as a whole. And here's what we found. Overall, the program is working. GLS has contributed to a considerable reduction in fatality rates for drivers aged 16 to 19. Specifically, a comparison of the fatality rates per 10,000 licensed drivers in Ontario for the first 6-year period for 6 years prior to GLS, 1988 to 1993, with the most recent 6-year period, 2005 to 2010, we saw that an average fatality rate for young drivers fell by 59%. At the same time, the average fatality rate for a control group of mature drivers aged 45 to 54 fell by only 48%. So a feature of the GLS program is that novice drivers who take the BDE can get a time discount and move from into G2 at 8 months instead of 12 months, so they get 4 months. So now let's shift to one component of the GLS, the BDE, to see if it's contributing to the program's overall success. So I'll start with a bit of background where we were in 2007. The Auditor General came out and he noted that the collision involvement rates for drivers who have taken the ministry-approved course were 80% higher than those who had not taken this course. But what the auditor didn't take into consideration were some confounding factors. The age of the drivers. G2 drivers with beginner driver education were mostly young people, under the age of 25. They represented 72% of that group. So those that take BDE are young. Whereas G2 drivers without beginner education, driver education, were mostly mature drivers over the age of 25. Only 31% were under the age of 25. So already we have 2 very different groups. We have those that take the course that are young, and they have their own set of characteristics, and then we have those that don't take the course, and they're older. Another set of characteristics. The auditor also didn't look at the collision severity as part of his analysis. So MTA went out and they retained Dr. Jock McKay from Waterloo. He's Associate Professor of Statistics and Actuarial Science. And we asked him to do additional analysis on the BDE program. Because instinctively we knew if you take an educational program, it shouldn't put you in a worse position. Dr. McKay found the following, confirming exactly what I said on the age. A quarter of those who didn't take BDE were under the age of 25, and 3/4 of those who took BDE were under the age of 25. So we already have very different groups. He also confirmed what we thought, that the severity of the crash wasn't analyzed. So he stated that drivers who had not taken BDE have a lower collision rate, ignores the fact that the older group had more mature drivers and overrepresented in the group. So we already know there was a faulty basis for the auditor. Furthermore, as drivers age, and I'll show you as we get to the graphs, and there's plenty of graphs from my staff, their collision involvement rates decrease until they reach their senior ages. So Dr. McKay confirmed that the collision involvement rates vary within each group, and this is really interesting. Well, I think it's interesting. That is, within the BDE group and within the no BDE group, there's much more variance in the group than between the groups. So you already have a problem at that point. So in 2012, we used TURF's methodology and Dr. K's suggestions and did our own analysis, and here's what I'm going to show you today. To eliminate the effect of age as an important risk factor for collisions, only records of novice drivers who obtained their G1 at age 16 to 19 between the years 2000 and 2009 were analyzed, so we only looked at young people. Teen drivers are divided into three groups. Those that took BDE and obtained a time discount, those that took BDE but did not take advantage of that time discount, they stayed there for the full time, and drivers who did not take BDE at all. So let's look at the collision involvement. And for simplicity, what we've done is we've collapsed the two groups. So we have the BDE group, includes all G2 drivers who took BDE with or without the time discount. And the second group is no BDE, a group that includes those that did not take a beginner driver education course. And if you look at the fatality rate and injury collision involvement rates of G2 drivers, those that took BDE were 12.3% and 8.3% lower than the involvement rates of G2 drivers who did not take BDE respectively. But you've got to note the numbers are small, so if you're just looking at the percentage, they're fairly small. On the other hand, the property damage only collision involvement rate for drivers who took BDE was 3.6% higher than the involvement rates of G2 drivers who did not take BDE. But again, the numbers are small. So evaluations of BDE programs in various jurisdictions showed little or no difference between the collision involvement rates of drivers who have taken BDE course and those who have not. But that might be due to the fact that driving courses at an early age might increase exposure, risk, foster overconfidence. There's a whole bunch of other factors that we could have looked at. So actually comparing the two groups, BDE versus no BDE, after the treatment, didn't really provide us with an answer because we didn't compare them before the treatment. They might be very different groups. So the next one is the increased risk of collision when G2 drivers graduated to G1 drivers graduated to G2. And as you can see from the chart, there's an increased risk of collisions when G1 drivers graduated to G2 is 46% lower for young drivers who did not take BDE. But then you have to say, does that mean BDE has a negative effect? And we'd say absolutely not, because there's other factors in there that we need to understand that were not part of the original evaluation, such as, do they have access to a car? What's the exposure in their driving? Do they live urban, rural? We really don't know enough about that group to make any kind of conclusion at that point. We just know we have a number. So then we couldn't use an actual measure for exposure driven because we didn't have it. So we used an induced exposure methodology to see if that would help us better understand the risk. That is, we used the percentage of at-fault collisions as a proxy measure for risk. So we took 100 people involved in collisions from each group and identified them if they were found at fault. Interestingly, we didn't really find a big difference here, at-fault collisions, between G2 drivers who took BDE and those that did not. So we're still not getting a lot further because instinctively we know that taking an educational course has got to be beneficial. But given we use an induced model rather than an actual exposure to better understand risk, our plan is to conduct a survey of young drivers to better understand their driving characteristics. So that's the next thing we're doing. We want to know the amount of their driving. We want to know their access to a vehicle. And we want to know their driving skill and attitudes before BDE, because that will tell us a lot more on how that group is behaving. So the next graph, I think, is very interesting. We compared drivers who benefited from the time discount, shortening G1 from 12 months to 8 months, to those that did not. If you look at that blue line, the one that goes up, that's drivers that took it with a time discount. There's an increase in collision involvement that's 13 times higher when you move from G1 to G2 with a time discount. If you look at months 8 to 12, once the restrictions are moved, a young driver's collision risk increases substantially. But if you look down further down the road, after 20 months, the risk decreases, and again after 36 months. the collision involvement starts to converge. So those three groups, as they mature and as they get driving experience, all come together again. So think about at the beginning when we talked about those groups, and we had in one group those that were more mature, that didn't take BDE. They weren't better off because they didn't take BDE. They could have just been more mature. They could have had driving exposure in other countries. They could have a lot of different factors that would account for that, and it wasn't the course. A previous analysis in 2002 by the Traffic Injury Research Foundation showed that Ontario's novice drivers who obtained a time discount had the highest collision rate amongst the three groups. So we're getting closer to thinking what might be the issue. We also looked at the conviction rate of 10,000 licensed drivers and found the following. The conviction rate for G2 drivers who did not take BDE was 30% higher than the conviction rate of those that took BDE. So this includes offenses under the Highway Traffic Act, criminal code convictions, things like that. So BDE appears to have a positive impact on driving behavior because you're less likely to get into an accident and be convicted at that point. So now a summary of our results. G2 drivers who took BDE have lower fatality and injury collision involvement rates than their counterparts. Furthermore, regardless of BDE participation, when graduating to G2 drivers, collision involvement is higher. Most G2 drivers are at fault in collisions. And finally, G2 drivers with BDE have lower conviction rates. So these stats should be taken, and what I'm saying should be interpreted with caution, because there are a lot of other potential factors, including novice drivers' access to a vehicle. Young drivers with access to their own vehicle have a 30% higher crash risk. So there's a lot of factors we want to look at. Access to the vehicle, as I said, amount of travel, differences in rural-urban driving, and driving skills and attitudes before BDE. We really need to understand those groups to understand the numbers that we're getting after that. So going back to the three questions. Impact of BDE. Does it increase or decrease the risk of collision? Due to the lack of data in relation to lifestyle, we can't ascertain whether BDE increases or decreases risk of collision of young drivers. Today, we can't tell. Effective time discount. Time discount is currently offered has a negative impact. When graduating to G2, young drivers' collision involvement is higher. And remember that chart. All of those groups, when they went to G2, went up. The one with the time discount, though, went the highest. Is the conclusion of the Auditor General's report that BDE has a negative impact on the safety of novice drivers true? No. So driver training and education are key to road safety, we know that, and MTO continues to promote driver training and education as a means of reducing collisions on Ontario's roads. We are committed to reviewing the latest research and the best practices in other jurisdictions to ensure that we continue to be a leader in road safety, especially for the novice drivers, because that's one of the areas of concern for us. We are doing a little bit more work now, and we have a few things that we're working on, given that the information that came out of our evaluation analysis. But there is one thing I just wanted to read. I was reading this last night, and I'm a big one on making business cases for a lot of reasons. But when I was reading through one of our notes, and it would be the same in any of the jurisdictions, in the first 5 years of GLS contributed to an estimated 1,400 fewer visits to emergency rooms, 15,500 fewer days in hospital, 9,900 fewer ambulances calls, and 137,000 fewer hours of police time. So when you think of the programs, and every time we better them, we not only save on the bottom line, because there is a business cost to government for sure, but then there's the social cost and the emotional cost to families.